for those of you that don't have a lot of experience working with back pain yet, it is definitely a case where you want to look at mechanical causes first, and then if that doesn't help, then you would look towards other sort of reasons for back pain. So what I'm saying is, in the Koshik model, you look at anamaya-kosha first. So you think about, oh, maybe you have a diagnosis. You know, that diagnosis is with bulging discs, and you've got, you know, a yoga student who's doing 9 million forward bends every practice, and that's probably not a good idea for those bulging discs, so you have them stop doing that, and et cetera, et cetera. There's lots to say about what to do about back pain, but that's where you begin. Then there's like a sort of subset of that, which is generalized things that reduce pain in humans from our perspective. And research is pretty good on that, where contemplative practices definitely change sort of brain response, you know, to pain, or can. So it's always a good idea to, like, let's say, teach somebody some real basic kind of mindfulness meditation as a sort of pain reduction technique. And then some people have been talking about stress, and, you know, there's research on this, but I will just say from my anecdotal experience, but it's a lot of people, clearly stress is not good for back pain, the same way it's not good for most conditions. So it impedes your body's ability to deal with problems. So back pain is no different than any other one. So you definitely look at that, but I wouldn't want to. I wouldn't want anyone, if you're new to clinical practice, like, you wouldn't want to get sidetracked by that and not deal with you know, the facts that you have. So the physical facts that you have. So most people that you see with back pain, and this is just a blanket statement, right, are going to be Westerners who don't use their bodies correctly, and possibly as much as they should. And there's going to be a lot of work to be done in terms of posture and getting their core muscles working again. So that's always where you would start. So I just wanted to say that, sort of interject that into the back pain conversation. And since I recorded it, I'll get some other people to listen to it. But you know, if you're a kind of fan of the work, there are many people that have done amazing work, actually getting people out of really intense back pain through non-mechanical methods, and I actually really respect their work. But you wouldn't want to start there. That is definitely not your first go-to, right? So, you know, weak, tight hip flexors and weak, you know, abdominal muscles and deep abdominal structures, et cetera, you know, are definitely a better first step.